everyone, and thank you for joining us today. I see all the participants logging in. We'll get started here in just a moment. And welcome to our 2024 conversation on recovery-friendly workplaces. All right, we have a full agenda for today. I already see some of you telling us where you're from in the chat. Perhaps you've been here before and you know that that's one of the prompts we'll do. So if you want to use the chat function and tell us where you're joining us from today, we'd appreciate it. This is a conversation about recovery-friendly workplaces. My name is David Shapiro. I use he, him pronouns. I am a white male in my late 40s. I have dark brown curly hair, large gray rim glasses, and today I have a clean-shaven face. Today I'm joining you from my home office in Denver, Colorado, and I am the Senior Program Manager for HealthLinks at the Center for Health, Work, and Environment. We're located at the Colorado School of Public Health. So first off, I just want to let you know that the views and opinions expressed today and in this webinar are those of the speakers only and do not necessarily reflect the opinions, views, or positions of HealthLinks, the Center for Health, Work, and Environment, or the Colorado School of Public Health. This webinar may have short mentions of mental health challenges, overdose deaths, substance use, and addiction. So please engage with our webinar to the level of comfort that best suits you. A recording and summary of the key takeaways will be shared after this session. We always start with a land acknowledgement, which I'll read now. As we gather in this virtual space, we honor and acknowledge that the University of Colorado's 4 campuses are on the traditional territories and ancestral homelands of the Cheyenne, Ute, Apache, Comanche, Kiowa, Lakota, Pueblo, and Shoshone nations. Further, we acknowledge the 48 contemporary tribal nations historically tied to the lands that comprise what is now called Colorado. Acknowledging that we live in the homelands of Indigenous peoples recognizes the original stewards of these lands and their legacies. And with this land acknowledgement, we celebrate the many contributions of Native peoples to the fields of medicine, mathematics, government and military service, arts, literature, engineering, and more. We also recognize the sophisticated and intricate knowledge systems Indigenous peoples have developed in relationship to their lands. We recognize and affirm that ties these nations have to their traditional homelands and the many Indigenous people who thrive in this place, alive and strong. We also acknowledge the painful history of ill treatment and forced removal that has had a profoundly negative impact on all Native nations. We respect the many diverse Indigenous peoples still connected to this land. We honor them and thank the Indigenous ancestors of this place. The University of Colorado pledges to provide educational opportunities for Native students, faculty, and staff, and advance our mission to understand the history and contemporary lives of Native people. A little bit about our program. HealthLinks is a public health outreach program. As I mentioned, we're located at the Center for Health, Work, and Environment at the Colorado School of Public Health. The Center for Health, Work, and Environment is one of 10 centers of excellence for total worker health funded by NIOSH, the National Institute for Occupational Safety and Health at the CDC. And what we do is we champion health and safety at work through healthy workplace assessment. And in general, we just embody the total worker health approach. If you want to learn more about HealthLinks, please feel free to reach out to us and reply to the email that comes after today's webinar. A few housekeeping items. All participants on our webinar are kept on mute for the duration of the presentation. We ask you to use the chat function on Zoom for a few things. One, tell us where you're from, which we see so many of you already doing. It's great to see participation from almost all 50 states and also many countries internationally. So using chat for technical assistance, we'll have someone on our team help you with any technical assistance issues we have. However, questions that you have for us, we encourage you to use the Q&A box on your Zoom toolbar. That's how we can vote on questions and help use them for the Q&A section of our today's webinar. Closed captions are available for those of you that need them. Use your Zoom toolbar for adding closed captioning. And we know so many of you are looking for your continuing education credits. There will be a survey that hopefully automatically populates at the end of today's session. You'll need to fill out that survey in order to claim your continuing education credits. And finally, the webinar is being recorded, so you will receive a copy of the recording at the duration about 48 hours after today's webinar. So, our agenda for today, we have a keynote presentation that grounds us in the science and research. We have a discussion with two speakers who are putting recovery-friendly workplace into practice in the field. And then we have a question and answer section as well. And our learning objectives are to define and understand the characteristics of recovery-friendly workplaces, be able to discuss impairment and how problematic substance use impacts the workplace, and identify the steps to becoming a recovery-friendly workplace. So with that, I'm going to go ahead and introduce our first distinguished speaker, Dr. Corey Vilsaint. Corey is the Associate Director of Recovery Health Equity at the Recovery Research Institute, a research scientist at the Center for Addiction Medicine, and an instructor at the Harvard Medical School. She is a community psychologist and an international speaker whose work has been recognized by awards from the American Psychological Association and others. Her research endeavors focus on racial health equity in remission and recovery, reducing recovery-related discrimination, building recovery capital, and improving recovery support services. So thank you so much, Corey, for joining us today. I'm going to stop my video and have you share your screen.
Absolutely. Thank you very much for the kind words, and welcome to everybody who is here. I want to go ahead and get started. I'm very excited to have just a few moments to talk to you today about what we know from the science and how that can be useful regarding the importance of building recovery-friendly workplaces. But that word recovery, that shows up even right here in the title of our conference. And that's why I want to just step into that a minute. Let's think about this a second, because what is the recovery construct, right? This is becoming more accepted amongst scientific, medical, and government communities. Really, so far, when we think about recovery at the individual level, we have really thought about indicators that have come from, let's say, the medical field. We think about, well, we know about remission. We know what treatment is, right? Or we think remission is an outcome. We might also consider substance use outcomes, such as reductions in use or abstinence. However, the thing I say there's a common thread here. They're all about the absence of something. Those are about the absence of pathology, the absence of symptomology, but recovery is more than the absence of something, okay? Recovery is distinct in that it's also about the presence of health and the presence of well-being. And so there has been a paradigm shift. We have moved from exclusively focused on pathology as indicators of remission or recovery, and now but recovery is about strengths as well. We are being more inclusive and understanding. You can see the difference in our terminology. We were focused on remission. We think about recovery and resilience. We were only focused on risk factors. We understand we need to understand protective factors now. It's not just about deficits. It is about our assets that support our recovery journey. We don't want to know everything that's just broken. We need to take stock of what is functioning, what is working, and for who. Yeah, right? We used to think about only this is about as a disease. This is about health. Recovery is about the health of substance use disorder. And in this paradigm shift, at the Recovery Research Institute, we have started introducing a number of what I playfully call recovery vital signs into the mix here. We don't want to just have this narrow focus about recovery. Recovery is about people's quality of life on this journey. It is about their recovery capital, which is in theory all of the assets and resources that are needed to initiate and sustain recovery over time. We care about their self-esteem. We care about their happiness as well. But we're coming from a medical field. And so we have these medical milestones, if you will, that are really have only been about the duration that somebody has been in remission, all the way from initial to stable. But what do we know about the recovery milestones? And this is how we've been able to bring science to bear on not only changing the narrative about what is recovery. Is it just a negative drug screen, or is it more than that? We want to be able to take recovery vital signs, add a precision to recovery by answering questions. In addition to medical milestones, we need to add a precision. Who needs what type of service? When in their recovery, for what duration, and at what intensity? This is the direction we're moving in. And in order to help do that, we took those recovery vital signs and we rolled them out in what we called the National Recovery Study, right? This was thousands of people who we enrolled into the study who said, yes, I used to have a problem with alcohol or drugs and I no longer do, right? And it was actually the first study on recovery that was representative of the US population. And we did that by making sure it was representative on US benchmarks, census benchmarks, such as one's income, one's race, where you live, a lot of different factors. And so for the first time, we actually had the prevalence of recovery and the prevalence by which people who've resolved a problem have used, let's say, recovery support services and things along that line for people who resolved a problem. And from that study that we did, and has then since been replicated. It was a landmark study. We know now that we have about 9% of the population, over 22 million Americans, have resolved a problem with alcohol or other drugs. 46% use that self-identity as recovery. And I want to show you about this study, those recovery vital signs that we've got from looking at thousands of people who have resolved a problem with alcohol or other drugs. What does it look like when we put in these strength-based indicators as well? So I'll show you here. I've got a graph here in which I'm displaying their quality of life, right? Which is their ability to meet their daily activities. Or you feel like you're able to meet your daily activities and tasks, their happiness, their recovery capital, those assets and resources that are needed to rebuild your life, as well as self-esteem. You can see for folks who are very new into resolving a problem with alcohol or other drugs, maybe even just a month in, you can see all these indicators start low. But as you look over the 40-year horizon, there is a sharp increase actually between 0 and 5 years, and then just a steady climb from 10 years out to 20 years. Look at the climb at 30 and 40. This is evidence life gets better. This is the hope of recovery. You've heard it in the narratives. People have told you. Now you can see it with the data as well. This is proof, right? This is actually getting a chance to actually look at recovery. And here you will also see, and this is not just because people got older. This is a graph that adjusts for age, because we actually know that some people actually get happier the older they get. We've adjusted for those factors. Look at psychological distress starting at its peak at the beginning with a sharp downward swing and just continuing and continuing. Psychological distress continues to get better. Life gets better. We've got proof of it. But I want to also show you an up close look at what happened on the 2-year horizon, because you can't see it on the 40-year horizon. We also now know that there is a dip that occurs. We now understand this is what was missing from remission, right? From negative drug screens. This is what was missing from the medical milestones. We need more of a recovery framework. You can see here that this is one of the most interesting findings, that around 6 months, sometimes people feel worse than they did on day one, right? We see what is happening at this time. This is the questions that it raises, right? We see the dip in the quality of life, the happiness, and the self-esteem. So what's going on at that time? This is getting back at those precision questions. Who needs what when? Does this type of, now that we understand course of recovery a little bit better, we have to challenge some of the systems we have that maybe are not supporting people during these times. We need to be more oriented towards building really recovery-friendly nation, recovery-friendly workplaces, because, you know, even in research, treatment trials only last 12 weeks, right? But this is what we learned about course of illness and recovery. We need supports at critical times. Who needs what, when? Again, let's cut that data by primary substance, right? Who needs what when? Well, I can tell you, if you look at it according to primary substance, there's a group of people who need immediate access to recovery capital, immediate access to things that will improve their quality of life from the very beginning. That is going to be individuals who said that they had resolved a problem with opioids or the other drug category, which is really about stimulants, a lot of stimulants. compared to alcohol and cannabis. You can see at the beginning, look at the way with the yellow line, other drugs, which is stimulants mostly, and opioids are much lower in quality of life compared to individuals who started on their journey in recovery from alcohol or cannabis. And again, same with recovery capital, right? Again, who needs what when in this journey, right? And then identifying resources, treatment in the or recovery support services, the whole infrastructure, getting people what they need. This is the evidence of what we need. So in summary, right, of those recovery vital signs that we are now learning about, we're understanding that recovery is a dynamic course, right? And we're learning more about the challenges and barriers that are inherent in each phase, right? Initially, there's this convalescence, right? At the beginning, it's kind of like the fire is out. There might be a calm when the fire first comes out, and this might be when people might have some support from family, from treatment. But we also know that starting around 6 months, it's almost as if maybe the smoke clears from the building and there's a dawning of reality, maybe, right? It's kind of like, well, look what I have to clear up. Look what I have to make up. These might be some of the things that are occurring during this dip of recovery vital signs. Critically, we have to continue to give people access to these types of building permits that are needed to reconstruct their lives. Employment of critical importance so that they can continue to climb the next phase of their recovery. And climb they do. There's almost a reconstruction phase as you continue out on this duration. This includes access to housing, employment promotions, nutritional assistance, reunification with families. And they kind of goes off into a conservation and growth period. This is what we're seeing. But why? Um, Again, more specifically, all right, so why does recovery friendly workplaces critical with this journey of recovery? I will tell you that the National Institute of Health has made it crystal clear that when it comes to the annual cost to society of substance use disorders, we are looking at about $600 billion. But the even more interesting part is that look where that number comes from. The blue part was, as you can see, is the vast majority of this pie chart is lost productivity. Some people might think, well, crime is probably the most. Look how small crime is. Well, is it because they're using the healthcare system? Look how small the cost of healthcare is. Folks, this falls on the workplace. This is the workplaces. And also, for a lens of interpretation, you need to understand. Some people might think, well, why, folks in recovery have trouble working. Oh, we have plenty of policies that work against this group that are keeping them out of employment for many years, both on the federal and state level. This is a huge function of our policies. This is why we have to be intentional with recovery-friendly workplaces, because the framework of recovery, that we operationalize to build an effective U.S. infrastructure must comprehensively address all components associated with this price tag. In other words, moving from this medical model alone to a recovery paradigm. Recovery is about global health. It's about medical and non-medical factors. This is at the intersection of recovery. And so the last piece of information then I'll leave you with, I told you about the National Recovery Study that we did, thousands of people. One of the manuscripts that we published in a scientific journal was about from working on recovery to working in recovery, we called it, employment status among a nationally representative sample of individuals who resolved the problem for alcohol or other drugs. And what did we learn about that? The importance, again, of focusing on recovery-ready workplaces. We learned when we compared it to, we brought in another sample of just the general US population, had nothing to do with SUD. And then we looked at our sample, who was people who had resolved a problem with alcohol or other drugs across the US. Compared to the US population in general, individuals who had resolved, a problem were less likely to be employed. And the thing is we looked at this and found this to be true, even amongst people who were looking for employment. So it wasn't necessarily because they were retired, because they were disabled. They were saying, I'm out there, I'm looking for it. So, and again, so we see this, the importance of recovery-ready workplaces, and furthermore, part of the two strongest predictors that who were be affected by this even more so were individuals who identified as Black and individuals who had multiple arrests on their records. Now, and this is an interesting finding, right? Because in one way you could say multiple arrest, that does make employment harder. We know that. We should probably be paying attention to more than just have you been arrested or in jail. That is a whole conversation. But why is it that individuals who identify as Black, this is kind of the caste system in this country that we have created around this is apparent even in recovery, in recovery, is that, I call this the effect of you don't have to do the crime to do the time when it comes to being employed. Okay. It shouldn't be that just because of how you identify racially, that's one of the strongest predictors of you not being able to get employment. This was independent of having multiple arrests, right? So not only do we see that that recovery ready workplaces, recovery friendly workplaces are going to be key in building a public health infrastructure, but we have huge opportunities here for equity in this country as well. For people who this should not be an indicator of being having difficulty getting employment, even when you want it. So this is why the White House Office of National Drug Control Policy has put out the Recovery Ready Workplace Toolkit. This is the focus on this. And this really is why you're here today, right? And so again, we've covered a lot of information really quick. So just so we stay on the same page, from the beginning, it was recovery is not just about the absence of symptomology. It is about the presence of health, the presence of well-being. This is about strengths and not just pathology alone. That's part of the recovery journey. Recovery vital signs have added precision to our understanding of this recovery journey and helping us to better understand who needs what when. We're trying to understand for what duration intensity. This is what's on the horizon, right? And when it comes to recovery friendly workplaces, why? Well, you saw that lost productivity was by far the biggest fraction of our annual costs related to substance use disorders. And we need these targeted efforts. We need folks like you showing up here to offer meaningful employment that can help produce this recovery ready nation that we are seeking to build. For anybody who wants to know a little bit more about us, the Recovery Research Institute, there's a QR code to take you to recoveryanswers.org if you need more information for any of your efforts that you're doing here. Thank you.
Thank you so much, Dr. Vilsain. It's so important to get grounded in the terminology and in the research and data. And I've had the privilege of hearing your presentation a few times now, and I always glean something out of it. So thank you for helping us set the stage here. For those of you joining us, please remember to use the Q&A section of your Zoom toolbar for any questions you have for Dr. Vilsain and the rest of our presenters. Also, I just want to mention a few things regarding terminology and words. Whether we use the words recovery friendly, recovery ready, respond ready workplace, we're all talking about the same thing, which is supporting individuals in recovery from substance use disorders in their work experience. So there's a few different words going on around the country right now. We're all speaking the same language. We're all focused on the same population. So with that, I want to introduce our next speaker who's going to help put some context about what it means to be a recovery-friendly workplace, and that's Greg Young. Greg is the director of the Recovery Friendly Workplace Pennsylvania program with Unity Recovery, where Greg utilizes his lived experience to provide employment support, training, and technical assistance to employers and supervisors of all kinds across the state. Greg identifies as a person in long-term sustained recovery since 2018 and has been working with Unity since 2020. He believes that reducing stigma and creating employment opportunities are crucial to help individuals in the recovery and reentry community move forward positively in life. Greg, thanks for joining us today. Tell us a little bit more about your work in Pennsylvania and what this looks like in the workplace.
All right. Well, thank you so much. First off, hello, everyone. Just really want to thank Corey for the great keynote and Janice for joining on the panel as well. HealthLinks, Colorado School of Public Health for having us here. and of course, all of you for joining us. As David mentioned, my name's Greg. I'm a 38-year-old white cis male. My pronouns are he, his, him. Today, I'm rocking my dark brown pompadourish haircut, with a light beard, my sweet tortoiseshell glasses, and a black Unity t-shirt. My background is just my little apartment with a nice scenic fall photograph. As David had mentioned, I want to talk a little bit about kind of the real life experience of what it is to implement recovery-friendly policy and framework within what we're typically doing, active and successful businesses. Most often the businesses that are seeking this type of training are those that are looking to either increase their retention or their recruitment ability and quality, or they're just involved in the recovery community in some way, whether they know they have staff who are in recovery or whether the owner, employer, supervisors may be in recovery themselves. We begin by just kind of getting to know the business. We have conversations through informational sessions, emails back and forth. We ask them to take what's called a employer recovery capital assessment. And that's kind of give us an idea of how recovery friendly this organization or business may be already. From there, we're really going to focus in on our training sessions on the gaps that we see based on that assessment and based on those conversations. Typically, we'll do 3 presentations covering the basics of what is recovery, or structural information on what these terms and definitions may mean, just really basic stuff for everyone to learn to get on the same page as we advance in the training, going towards what are the benefits of supporting recovery in the workplace. And of course, we know that operating in these frameworks is going to create opportunities for higher productivity, less absenteeism, better retention, better morale, higher quality recruiting. We're going to save money on healthcare costs and premiums, as well as all those costs associated with termination, with the hiring process, onboarding, and training. Finally, we're going to go into presentations about how to actually be a recovery-friendly workplace. How do we look at these policies? How do we reframe them in a recovery-friendly manner? And how do we talk to anyone who's in a position, a supervisory role, about how to interpret these policies and implement said policies? Because it's much more than what's in black and white in an employee handbook. It's how we're handling these policies in real-life situations. We do also offer an additional presentation called Supportive Supervision. This is a deep dive into a specific management tool, typically reserved for organizations who are operating in the recovery community, especially if they're operating with peers on staff. We think this is a great presentation on just how to operate inside of that world and make sure we're really supporting those people that are doing the real work out there each and every day. The core goal here is always to create a recovery-friendly atmosphere or culture from the top down. We put a heavy emphasis on leading by example, so leadership really needs to take into account for themselves, be focused on utilizing empathy and compassion when they're dealing with disciplinary situations or difficult conversations with their staff, understanding the unique needs of their individual staff. We all have very, very different lived experience, whether that involves recovery or reentry or not. We need to understand what people have gone through and how things affect them before we can make decisions about their future of employment. In addition to that, general cultural competency, we take a big look at that. And the best way to go about cultural competency, of course, is to just give people a voice, give people a seat at the table. If you have folks from different identity groups on your staff, when you're creating new policy, they may impact them, whether that's, being more inclusive with the holiday choices for time off or being more flexible with what people need. It's having people have those conversations, getting that input and forming policy with the folks that it's going to affect the most. Beyond that, we're always looking to make sure that people are approachable, that they're available to staff. If they're not available, they're not just yelling, saying go away, but they're saying, hey, let's talk later, these kinds of things, and how to handle some of these difficult conversations around recovery in the workplace. Also, just being very, very proactive about staff wellness and making sure we're giving those appropriate benefits that staff can take advantage of. Most of all, we need leaders and all staff to understand the importance of employment as a piece of capital for individuals in recovery and reentry, and how we can reduce the stigma, bias, and discrimination about recovery and reentry through our everyday language and actions within the workplace and even beyond. Some recent examples of Pennsylvania certified recovery workplaces are Ursinus College, Parks Casino, Partner for Work, which is a workforce development board, and Cook and Solo, which is a large restaurant group here in Philadelphia. These companies went above and beyond to form internal committees focused on recovery-friendly initiatives, making sure to include their staff, include their human resources, their legal departments, their board of directors, getting input from outside organizations and others that have gone through similar programming, and really bringing all organizational stakeholders in on the conversation and being a part of the process of formulating those new policies and teaching others how it is to be interpreted and implemented. These have created tangible goals with continued education, training, and technical assistance. These organizations are now committed to paying a living wage, offering appropriate benefits, making flexible scheduling, and most of all, hiring and supporting these individuals in recovery and reentry. It's important to remember these policies are not only for folks that are in the communities that we're serving. These are for all staff, because in the end, we all have our own struggles in our lives, our own unique experience. And honestly, everyone deserves to be heard and given that support. So with that, again, thank you for having me, and I'll toss it over back to David.
Thanks so much, Greg. We really appreciate the work that you're doing and doing in participation with Unity Recovery. I know our team members and other individuals on today's webinar will have some questions for you about how you put it into practice. As a reminder, if you have questions for any of today's presenters, the Q&A box is the place to do that. We're going to do our best in about 8 minutes or 10 minutes to get through as many questions as possible. And so that's where you want to ask questions of our speakers and presenters today. With that, I'm going to introduce our third speaker of this webinar, which is Janice Hartgens. Janice joined the National Safety Council in July of 2023. A registered nurse executive, Janice has over 30 years of management and leadership experience in both the hospital environment and the transportation industry. And since joining the council, Janice leads the effort to get naloxone into every workplace in America. So we're going to shift here and talk a little bit about opioid use disorder and the importance of emergency preparedness of having naloxone in the workplace. And Janice, just give me a moment to pull your slides up.
Thank you so much, David. Thank you for the invite, and thank you to everyone who's participating on the panel, Corey and Greg. I certainly will not be able to do an introduction as sharp as Greg's, but I look forward to presenting today. And yes, I'm Janice Hartgens, and with the National Safety Council, I lead the Respond Ready workplace effort here at NSC. And our goal is that, as David talked about, is to get employers to adopt having an naloxone program in the workplace. So our Respond Ready workplace program is really built on 3 pillars. We wanted to really keep it simple for employers to be able to understand that we can impact unintentional overdose deaths in the workplace, and really get them to support having those programs. So awareness, access, and adoption. Those are the keys to our Respond Ready workplace program. We wanted to create awareness, and over the last year, that's what I've been doing by doing presentations and really increasing the awareness of the fact that unintentional overdoses are happening in the workplace, and also to bring attention to the stigma that occurs around substance use disorders, and really get employers to look at how are they dealing with that stigma within the workplace as well. And then access. Since naloxone was just made over the counter last year in 2023, in March of 2023. So we've just actually had our first year of having naloxone be available over the counter. Before that, employers talked about how difficult it was to be able to get access to naloxone. And at NSC, we've also worked closely with Emergent Biosolutions, the makers of Narcan, to help employers be able to obtain naloxone directly from the manufacturer. And then when we talk about adoption, we want employers to adopt having naloxone in the workplace as part of their emergency response plan, to train employees on how to administer naloxone, and really be able to understand the signs of an opioid potential opioid overdose in the workplace and be able to respond. So with that, awareness, access, and adoption, those are the pillars of our Respond Ready Workplace program. At NSC, we follow the data. And so using injury facts, some of you may be familiar with our injury facts at NSC. We follow the data. And the data for us has shown, if you go to the next slide, our data has shown that overdose has increased in the last decade, has increased. Unintentional overdoses in the workplace has increased over 600%, as well as nearly 10% of all workplace deaths. So for whatever reason a death occurred in the workplace, nearly 10% of those are from overdose. And in 2022, over 275 people per day died from an opioid overdose. So overdoses are happening in the workplace. A lot of times employers are saying, it's not happening here. We don't have a problem with overdose in the workplace. But as you can see, overdoses are happening in the workplace. And if they're not happening in the workplace, someone in the workplace has been touched by someone with a substance use disorder, whether by themselves, because 66% of people with a substance use disorder work. So they're in the workplace, their significant other or family member. So we've been touched by someone with a substance use disorder and in our lives. So it is happening in the workplace. And also we have to think about our employees who have also been touched by the impact of substance use disorder. Next slide, please. So our data shows us that the industries most impacted or most affected by workplace overdose are construction, manufacturing, and transportation. However, we do know that also there are other industries that have been impacted, as well as other ethnic groups out there that have been impacted as well. But we follow the data, and the data trends show us that construction, manufacturing, transportation, utilities, and trades have been the most impacted over the last decade by overdoses, unintentional overdoses in the workplace and the deaths. So we are focused on those industries, but we also provide information that is accessible and usable by every industry and anyone that's been impacted and touched by substance use disorder and want to have a naloxone program in the workplace. If you go to the next slide. So this slide is some resources that we've put together in our Respond Ready Workplace program. And the one thing we talked about, I started out and I talked about one of the pillars of our program is adoption. And so we've created a free e-learning for the administration of naloxone. And it goes through the signs of an opioid overdose, but it also has some interactive pieces on the administration of naloxone, as well as hands-only CPR. And we understand that when you administer naloxone, the goal is to get that person breathing again. However, when you may be in an instance where you've activated EMS, as you should, with someone of a suspected overdose, and you may be on a call with EMS and they're asking you to perform some hands-only CPR. So we do provide some training on how to perform hands-only CPR within our free e-learning. The other resource that we have is our implementation guide. This guide helps employers implement a naloxone program in the workplace. It has some policy templates in it. It has some information on how to at least get your stakeholders involved and things, and how to go about implementing a program within your workplace. And then we have our link to our discounted program with Emergent Biosolutions for Narcan, to be able to purchase Narcan through the NSC link. So we're trying to our best to really provide employers with the tools to be able to implement an effective program within your workplaces. So I think that's my last slide, David.
Absolutely. Thank you so much, Janice, for that presentation. I'm going to ask all of our speakers to come back on camera for this now Q&A section. And we have some terrific questions coming up in the Q&A, which I really appreciate. So as we reset here and we bring Dr. Vilsaint, Greg, and Janice back in, I'm going to engage us in a little bit of an exercise here because words really matter in this community and in general. And so this first question, first I'm going to read the question, and then I'm going to reframe it in hopefully non-stigmatizing language. And so let's read the question first, just so you can all sort of hear how we do this when we're working with individuals. So the question was, with high relapse rates and sometimes desperate behavior of some addicts, how can employers provide ongoing support without putting their business and other workers at risk? Okay, so that was the question. Now I want to reframe it in hopefully a little non-stigmatizing language, okay? So with high relapse rates, we're trying to use return to use or recurrence of symptoms instead of relapse. So what we'll start with in that first phrase is with high recurrence of use, and the second piece here, sometimes desperate behavior of some addicts. So let's reframe that as well. So with high recurrence rates and sometimes difficult or challenging behavior of some people who experience substance use disorder, right? So we've now changed addicts to a person experiencing substance use disorder. How can employers provide ongoing support without putting their business and other workers at risk? So, Greg, maybe I'll start with you with this question. We've reframed the language a little bit, and I'm just curious your thoughts about how are you going to balance the challenges that individuals who experience substance use disorder face with the day-to-day operations of any business?
I think this is probably the primary conflict that we face in this type of policy framework, where we want to be, again, leading with that empathy and compassion at all times. We're looking at individuals as humans, and employment is a very, very vital piece of capital for these individuals. So when you see, recurrence or behaviors that might be pointing towards that, I think it's really incumbent upon supervisors, employers to offer resources in a number of ways. So this could be through bulletin boards, an HR director's office, a web portal on the website, an email blast, things that people could access without having to speak to a supervisor or an HR professional or anything like that. Above and beyond that, having policies that say that we are going to respect recovery status as it is covered under the ADA, and say, hey, if you need to go back to a PHP, an IOP, or a full treatment program, we're going to reserve your job, or even better, we're going to pay you for that time off. These are investments in that future of that employee and the future of the company, because if that employee does turn themselves back around, get back on track, they're going to be more loyal, more productive, less absent, and they're going to be just somebody that really champions the organization that you're with. So considering the administrative burden of hiring, firing, severances, all the costs associated with onboarding, training, the insurances and all these things, and the healthcare premiums that potentially come with things. These are all questions of cost and questions of safety. So as long as somebody's acting in a safe manner, you keep them on, and if you give them an opportunity to get better, you work with them, making coaching plans. Everything's in collaboration with the staff member, and there's always going to be a line. This is not, give people a chance till the end of days. This is, if somebody's taking it seriously, they're taking the steps to do better in their lives, we're going to keep them employed. We're going to keep them going. If they choose another direction, we're going to do what we can to support them, but at some point you do have to cut the cord, unfortunately. And this is something we always have to ask, and there's no correct answer at what that exactly looks like, but we can work with organizations based on their exact circumstances and decide how much of an investment can we make, because we value this person as a person, we value this person as an employee, and we see it as an investment in our future.
Thanks, Greg. I'm gonna move this question over to Dr. Vilsaint as well, Corey, to see if you have any ideas. I'm thinking that with what we know about these dips that you mentioned, there may be additional support needed for people at certain time points of their work experience. But I want to say this question again with the language that I use, because I think it's really important for everybody in the audience to hear a little bit about the language that we're trying to use in these conversations. So with high return to use rates, or with a high recurrence of symptoms, and sometimes difficult or challenging behaviors amongst individuals who experience substance use disorders. How can employers provide ongoing support without putting their businesses and other workers at risk, do you think?
Yeah. And I think the first thing that we do when we start looking at this is going to be when somebody is symptomatic, right? When somebody is symptomatic for this or any health condition, this is how we first step back and take a look. Any health condition that might be impairing their job to make sure that we don't create double standards amongst health conditions. How are you supporting other people who may have encountered problems at work, inability to meet needs? Because of a health condition. That's how you first make sure we don't step into double standards and help give yourself a framework of calibrating. Outside of that, there's conversations going on regarding, I know, for example, we've been having conversations about the role of employers and supporting recovery housing and possibly recovery housing as a benefit because recovery housing has shown actually very strong, considerable outcomes that can rival that of treatment, including for those with opioid use disorder. Is this a benefit you want to consider for your people? In other ways, we've seen outstanding, for those who are able to do things, for the Physicians Health Program. This was a program designed, tested for doctors who were having a recurrence of symptoms and showed, my goodness, about 70, 80, 90% success rate when that program was tested. Of course, that's a group of individuals who have high recovery capital, a lot to lose. But there have been programs tested that people have adopted so therefore when a work incident comes, they've got somebody, a way of responding that's been informed by a program like that to help guide efforts. And so I'll stop there and give it back to you, David.
Thanks, Corey. Janice, do you have anything you want to add about specifically naloxone and opioid overdose and how that might be something that businesses should be prepared for in this conversation?
I think everybody's pretty well covered it here, but again, we're saying that having naloxone and having employees know that there is a response to a potential overdose within the workplace does add a sense of security within the workplace, but also it talks about the support that the employer is showing for those that may be in recovery. And we also know that as employers, when employers adopt these kind of programs and train employees on how to respond, they also are impacting the community, right? So this is an opportunity as well to force multiply those people that can respond within the community. Because they're now trained. So there, as Corey talked about, as Greg talked about, there are things that you need to look at as far as consistency on how do you approach any situation within the organization, being consistent, and then providing the resources for those employees to tap into. But having an naloxone program also is one of those resources that when we make the entire employee population aware of, they then become added support for those employees that are in recovery.
Got it. Makes sense. I'm going to stick with you, Janice, for this next question. When I've had the privilege of presenting some of National Safety Council's slides and data in a number of settings, and just really appreciate the support that NSC gives to this conversation. And that statistic on overdoses in the workplace is really something, as someone who works in occupational health and safety, is pretty alarming. And that's what the question came up as, to see this poisoning or overdose statistic really rising at alarming rates. And the question is, did NSC, or I have a feeling that I may know some of the response to this, but I'll pose it to you first. Were there any identified factors for why that increase was so drastic in such a short amount of time? Did it have to do with any specific factors that you all know about? My guess is synthetic opioids had something to do with it, and the introduction of fentanyl on the scene. I don't want to take your answer from you, but was there anything else besides that, that contributed to those rates increasing so alarmingly?
Well, I think when you look at the spectrum of when opioids came on the scene, I guess, around in the 90s and coming into as prescription medications, and as we go through the spectrum of that heroin, and then we see the rise when the synthetic opioids were introduced into society and into the I guess into the stamped pills and things like that, and the availability of being able to get those substances. So fentanyl was a big, definitely a big factor in that. And then there's also, as we talk about some of the industries and how they're impacted, and some of the cyclical work that happens within construction, some of the MSDs and how these drugs are prescribed at first and then could lead it to a substance use disorder after an injury on the job. So there's many factors, but absolutely the fentanyl and the synthetic opioid use was definitely a factor.
Yeah, thought so. I'm gonna shift gears to a couple other questions that are connected now. And Greg, I think I'll start with you perhaps. So there's this question here about when and how do you think individuals should disclose that they're recovering from substance abuse or a substance use disorder in the workplace? There's some legal ramifications we know. There's some, questions of human resources and the human resources team. We have another individual who's asked about stigma in the workplace, but what does it look like for someone to disclose this medical history in your experience? And what should people be thinking about if they're planning on disclosing their own lived experience with their employer?
Well, certainly the answer to the initial question is when they feel it's right.
Right.
There is no prescribed time to say, hey, I was in recovery for this, that, or the other. It is a personal choice to publicly disclose that, whether it's to the whole staff, a direct supervisor, the employer themselves, it doesn't matter. Basically, what I would suggest, I'm somebody that has been loud in my recovery since day one, very upfront with employers. My first job coming out of treatment, I needed to go to IOP. I needed 3 days off a week where I could go and do this. I had to work with my employer for that. Now, it's all about getting to know who you are. The employers that we're training them on looking for what would be traditionally red flags, gaps in the resume, career changes, things of this nature, lack of professional experience. And to look past that and bring people, again, a seat at the table, giving them an interview, having a conversation. And during that conversation, as the person in recovery, you're going to pick up on how is this person talking about some of these issues in the workplace? Are they even addressing them at all? What we are always striving for is to create a recovery-friendly culture inside of the organization, which makes people comfortable enough to just talk about these things freely without fear of that stigma and discrimination. And I love that you led with the Q&A with reframing a question with the appropriate language, because that's what we need to do. We got to get away from the stigmatizing language, junkie, addict, homeless person, all these things that bring up all these preconceived notions of what people are, when in reality, we're just everyday people. We're your workers, we're your neighbors, we're your customers. So I think it's a very personal choice. It's a gut feeling. I think if it's unnecessary and you're not comfortable, there's no reason to share it. If it's going to affect something with a schedule and you need to have a deeper conversation with somebody in a human resources department, there are ways to talk about that. As an employer, supervisor, or HR person, you are not to ask about that. As David alluded to, you cannot ask somebody about that, but certainly you can use some probing questions in and around why someone might have large gaps in their resume, or they haven't worked in several years, or maybe never had a job at all. But again, we want to get to the point where we're having a conversation, right? We're not just putting the resume in the trash bin. So.
Thanks, Greg. I want to think about this, Corey, from a racial equity lens as well. We all have different backgrounds and experiences. And I'm curious, since you've done a fair amount of work on racial equity in the recovery and reentry space, do you have any thoughts about disclosure? What that might look like for different individuals of different backgrounds from a psychological safety standpoint, what we should be considering?
Yeah, I'll tell you what, a number of my colleagues did author a study that we called an investigation of comfort with disclosing alcohol and drug histories. And again, that came from the National Recovery Study. You know, and when it comes to, I think, a nice first start, boy, I wish the science could give us an exact answer to that, right? Isn't that what? But really, we have to go, right, in our what we call our lived experience in our lives. But what we can glean from the science is to get a little bit of understanding of why, when, and with whom people are willing to start disclosing. And I think that's a good first place to start. One of the things that we learned is that participants were really more comfortable disclosing with family, friends, less discomfort with disclosing to coworkers, first-time acquaintances, or in public settings. These effects did vary by the primary substance that they were in recovery from. So understand that's going to affect people's trajectories and comfort with telling you about their medical history as well. And so we actually found that participants who had problems with opioids and stimulants had significantly more disclosure. I'm sorry, people with other drugs had more and less disclosure with those who had problems with opioids. So sorry to get a little wrapped up at the end. You really need to kind of look at that study. Hopefully they can share it in the follow-up email to get the details on that study.
Great. I think the overriding sense here is it's on the basis of how an individual feels comfortable and what their workplace environment looks like. So much of this is really human and people-centered. And I want to mention regarding language as well, that if an individual who's in recovery wants to use the word relapse or addict or whatever, I say go ahead and let them use whatever words they want to define themselves as, right? As a community, we can reframe these conversations using words that are non-stigmatizing, and we try to do so. That being said, if you're in conversation with someone and that's how they self-describe, they have every right to do that. A couple other things have come up, maybe just quickly. Where does nicotine in your mind, Corey, since you're in this field and in the medical profession as well, where does nicotine and tobacco fall into this recovery space, if you don't mind me asking, on a high level?
Oh, yeah, sure, absolutely. You know, nicotine is an incredibly important substance too, you know, given the morbidity, mortality associated with it. It is extremely important to understand. I'll say personally, for me as a scientist, due to the lack of psychoactive effects of the substance, sometimes I try to study the other substance use disorders more than the nicotine effects. Now, not because nicotine's not important, but it is a different substance when it doesn't have the psychoactive effects. Now, hey, where does nicotine fall? You remember that old theory about marijuana is a gateway drug? Is it a gateway drug, right? We used to talk about that. The science did not hold up for that. But I'll tell you, if you wanted that framework of what's a gateway drug, nicotine is the strongest predictor of later substance uses. So that's what we do know about nicotine. Thanks for
Got it.
asking.
Yeah. Greg, do you have anything you want to add about your work in workplaces? I've looked at a lot of tobacco-free workplace policies myself as a public health advocate and in the work we do, but I know that substances like tobacco and caffeine can be challenging conversations for individuals in the recovery community. I just wonder if you have any thoughts as we sort of wrap up this Q&A section about where nicotine falls in this friendly, recovery-ready conversation.
Yeah, I mean, certainly in my own personal experience and in the recovery community that I'm a part of, nicotine and caffeine and things like this are actually kind of those substitute substances for their problematic substance. And oftentimes, and if somebody's got these co-occurring, substance use, can't even say disorders, right? A lot of people drink coffee, a lot of people smoke cigarettes. If you want to call it disorder, what you define as a problematic substance for yourself is your own decision. As far as smoke-free or tobacco-free workplaces is not something that we champion necessarily. Certainly, every workplace has the right to create their own policy procedures around that. My recommendation to be inclusive of all staff members that are participating in a legal activity, creating a safe space for them to do so that does not disrupt the other workers, no secondhand smoke, no butts on the ground, these types of things. We would encourage that they offer a space for staff who may smoke cigarettes or other nicotine products. And certainly, I think every office in the United States offers coffee. So, no harm, no foul. And again, with recovery, it's an individual definition and an individual thing. For me, I don't describe myself as sober or clean or abstinent or anything like that. I just say I'm a person in recovery specifically from alcohol and some mental health stuff that I work through. But it's really up to the individual and the workplace itself.
Great. Well, again, I'm an advocate for smoke-free, tobacco-free campuses and workplaces. So as a public health professional, I want to make sure I put that out there. I want to thank again Corey Vilsaint, Greg Young, and Janice Hartgens for joining us on today's panel. Such a great discussion with such a variety of life experience and expertise in this subject. Our next webinar is coming up on October 16th. We're going to talk about ageism and all of the different generations in the workplace. This is another sort of diversity, equity, inclusion, and community engagement conversation. We have presenters from the National Institute of Occupational and Safety and Health, from NIOSH, and a few other consultants in this space that talk about ageism. And so we hope that you'll join us for that conversation as well. And as always, we want to thank all of our participants for joining us. The link to the survey should have populated in your chat, and it should also come up as you exit today's webinar. If not, those of you that are on the webinar today will get a link to that in the follow-up email, which generally we try and send in the next 24 hours. If not, we'll have it in the beginning of next week. Again, thank you to everyone that joined us today. Thank you to our speakers and panelists for the robust and engaging conversation. We appreciate you being here, and we appreciate the work you do. Recovery Month is coming up. The month of September is busy with a lot of recovery events. Whatever state or country you're joining us from, if you just Google Recovery Month in your local state, you're going to have a lot of events and activities that you can participate in to learn more. So I encourage you to do that. And thanks again for everyone joining us today. We're all in this together for supporting recovery from substance use disorder. Have a great afternoon.